Oh, my aching back. That and a whole lot more in the way of pain and discomfort can be the result of crouching over a computer screen for hours on end. But there are treatments available to help alleviate the problem. And we're here to learn about them now at the North Oakland Chiropractic Clinic. And I'm here with Dr. Bill Ruch. Dr. Ruch, explain to me how you go about helping someone that comes to you with that kind of a complaint.
Well, they need to be evaluated.
Right.
Everyone's got different problems. A lot of people have a history of trauma, car accidents and such, that hasn't been properly dealt with, and their workstations and job activities are exacerbating their condition. A lot of people are forcing their bodies to fit into a workstation, and this attempt to adapt their body into positions that aren't good, healthy positions for long periods of time causes joint distress, muscle spasms, and immobility and pain.
If they don't do something about that, what can the end result be down the road? You're serious?
This is the etiology or the source of chronic degenerative arthritis.
Because so many people, especially those who have been injured previously, continue to suffer with back pain and other pains in other parts of their body, which really are brought on by simply the fact that they are doing normal procedures wrong in their daily lives. And Dr. Ruch now is going to demonstrate, with the assistance of an able assistant, the proper things to do to help alleviate many of these problems. Dr. Ruch?
The vast majority of patients that come to us with complaints of low back pain have a distortion of the pelvic girdle, which includes the two hip bones and the sacrum. The joints are the pubis symphysis and the sacroiliac joints. And a distortion of these three bones and three joints will cause a major amounts of muscle in the body to become distressed. And besides the chiropractic adjustments, the ways to manage this is the monitoring the motion of the legs. And one of the common things that can make this problem worse is getting down on the floor on one knee. And what happens in this position is that the pelvis then distorts in a more extreme manner than getting down in a proper fashion, which she will demonstrate. All right. Now, another thing that's common to people with low back pain is a stretch routine that's taught to stretch one leg at a time to stretch the hamstrings, and that will also add to the distortion of the pelvic girdle. And if we do a proper stretch, would be stretching the hamstrings on both sides together. Now, another stretch routine that's very common is that, again, to stretch the hamstrings, but a proper stretch would be with the legs together. All right, and then getting up off the floor would be performed like that instead of on one knee to get up off the floor. That would not be the right way to do it. Now, some of the stretch routines that were taught for hamstrings, again, would add to the pelvic girdle distortion, and the proper way to stretch like that would be both legs together. And a stretch for the gastrocnemius, or the calf muscles, and the Achilles tendon is a one-legged stretch like that, which again would add to the distortion of the pelvic girdle once it's injured. But a proper way to stretch would be both legs together, where you're stretching both quadriceps and Achilles tendons together. All right. Now, we're going to demonstrate some things about the chair, and a lot of people have to sit in chairs that are too low for them, and they are going to be loading the low back more significantly in a situation where the hips are at the same height or lower than the knees. And these muscles become very tight and the joints are compressed. And what makes this condition worse is the way normal procedures are done. For instance, picking up a pen off the floor, pitching over to one side is going to then cause an unequal balance with all the weight going on one hip. Right? A proper way to do that would be to bend straight forward so the pressure on both sides is the same. This could also relate to how someone is reaching for a low drawer or a purse on the floor, and anything else that's low, including reaching to one side. Bending straight down with the legs together is a more proper and less stressful way to deal with those tasks. All right, now when we're dealing with chairs, we really strongly feel that dealing with a chair that's higher is better for the pelvis and low back, because these joints will become less compressed. These joints become less compressed when the hips are higher than the knees. And this also makes it easier to get up out of the seated position. And again, the use of the legs is more symmetrical. Now, when we're going to be dealing with issues like the car, we are going to then look at the improper way, which is one leg's on the ground, one leg's raised up, one cheek hits the seat first, and that is an asymmetrical way to get into the motor vehicle. The proper way to get into the motor vehicle would be to have both cheeks hit the seat at the same time and swing the legs into the car. Now, getting dressed is another issue. One of the common ways to get dressed is with one leg up, the other leg is on the floor. But if we have the person sit on a chair and put each foot into the pant leg, keeping the legs as close together as possible, and then pull the pants up, that would be a less distressful way to dress once the pelvis is injured. And then the same procedure with doing shoes. And sometimes a shoehorn can be helpful, but keeping the feet close to the floor, the knees close together when you're putting your shoes and socks on will be very helpful in managing this type of injury. We find that there are a number of normal things that people do that had no problem at all in their health until an injury occurs, and then once an injury has been sustained by some of these joints, then those normal procedures have to be reevaluated because of their daily exacerbation of these injuries. Some of the injuries that we're managing with the pelvic girdle are going to be exacerbated by the way you get into and out of bed and the positions you are used to adopting in bed. And again, if we're dealing with pelvic girdle distortion as a major factor, how you are loading the pelvis as you get into bed and then how you distort the pelvis with the position of your legs become critical issues in managing your low back injury. So Anand is going to show us the improper way that some people get into bed, and then sometimes it's down on one knee to twist, and all those various types of activities will add to the distortion pattern of the pelvis. So the proper way to get into bed would be to sit and then pivot and then go into the recumbent position. And then the improper positions to sleep are going to be with one leg up, all right, in the various manners that we have. And the proper way to sleep would be to be on your side with a small pillow between your legs, sometimes taking a blanket or a large towel and putting it in a pillowcase to hold its shape would be a way to deal with that. And being on your back with your legs together, again, with maybe using the small pillow underneath your knees to provide some support. What we find is a common feature of the problems that we deal with pelvic girdle injury is that habits that were developed prior to the injury now add to the chronic and daily exacerbation of the injuries. So hopefully this will be helpful in managing your injury. Thank you.